One of the injection therapies that I do here at my office is called biopuncture. And people will say, what? What is that? Bio meaning just natural or from nature, like biology, from nature, study of nature, natural sciences. And puncture meaning that we're actually puncturing the skin. So in this situation with biopuncture, I use homeopathic medicine. And in this case, with this patient, his chief complaint is shoulder, neck tension. And sometimes later on you figure out that there might have been a previous injury. Arnica is, you might have seen it as a flower mountain biking here in Colorado. Here it comes in these little vials, and it's basically just vibrational medicine. You can look up homeopathic medicine or remedy at some time. And so what we're injecting is the recording of the vibration of the arnica. So there's actually really not really anything in particular in there. Some remedies in homotoxicology will have a little bit of physical sustenance in there that the body has to digest, but it's not like a full, like I'm injecting an herb or a drug into the area. So once we've assessed, and we're always going to do a diagnosis before we go. We're not necessarily just injecting where the pain is. So as I spoke of earlier, we can look as a muscle or a meridian as like a rope, and when it gets congested along the way, it can narrow, it can knot, it can shorten in any way. And so what's nice about biopuncture is that we can utilize these proliferants to open up that particular place. I also have remedies, homeopathic remedies that we use for sore throat, and I'll inject them into acupoints. So someone has a wind heat condition, which might be a virus in Western medicine, to release that heat, release the fever, and we'll inject it into specific places. And so it moves that pathogenic factor or that cold on much faster, especially if you are able to come in the first 24 hours. Something you might have for 2 weeks, you might just have for overnight or maybe a day or so. So we've already cleaned off this area. It's a sterile zone, and we're going to go up to specific famous acupoints. This again here is the small intestine 11. I'll have the patient breathe in and then exhale, injecting some of the substance, and that's pretty much it. The patient will generally feel a dull, achy sensation because what's happening is that area that was congested opens up, and so you're getting a vasodilation or a qi blood circulation, and that's releasing, helping to open the upper back and down the ulnar line or the small intestine meridian that goes out through here. And I'll go through different specific areas or specific acupuncture points to release this channel and the patient's shoulder. Breathing in here and letting go. Sometimes the muscle might jump, and that's called the arrival of qi in Oriental medicine, or called de qi. When that does, that means we actually bullseyed the point, which is great. And the idea is that you don't want to abuse the muscle and keep doing that, which can happen with some dry needling that can create some trauma to that area, or needle phobia in the patient. We don't want to do that. We always want to have the patient comfortable and able to communicate at any time if anything might be uncomfortable.